Hi everyone and welcome to my channel, Real Talk with Jamey. So once again, let us just take a look. So when we talk about endemic, outbreak, now let us just take a look at the other two new terminologies, and these are endemic and pandemic. So let us focus first on epidemic. So when we talk about epidemic, so from an outbreak can turn into epidemic, just like what happened to Wuhan, China. So there was an outbreak of this COVID-19, and because it spread, it has a sudden increase, just like what is in the definition. So epidemic, just like what you have read a while ago, a definition from CDC, which is Centers for Disease and Control and Prevention in the United States. It is a sudden increase of the number of cases of a disease above what is normally expected in that population or in that area. Or if it's something that is new, it can be a disease that affects a large number of people within a community, a population, or country. Now, epidemic siya within Wuhan, China, and in Hubei area. Ang daming naapektuhan, di ba? O naapektuhan. And then, when it spread out of what we call China, the epidemic then became pandemic. Right? So, a pandemic, just like what was defined a while ago, is an epidemic that has spread over several countries, continents, usually affecting large number of people. A worldwide spread of an infectious disease rather. So that is what we call pandemic disease. So COVID-19 actually is a pandemic disease because it's a worldwide spread of an infectious disease with larger reach with epidemic. So mas malaki ang naapektuhan niya compared sa epidemic within that country lang or that region. This is pandemic because it also spreads to multiple countries as well as continents, as we have mentioned earlier. Now, because this is pandemic, definitely another term that you might usually hear in our local news, whatever station it may be. In US, there are different channels. In the Philippines, madami din tayong mga channel. So, CFR. So, when we talk about CFR, so CFR simply means case fatality rate. So, these are the number of people or mortality or people who passed away simply because of this contagious disease. Now, how do we actually get this? Number. So, this number is, there's a formula for this. The formula for this is calculating it. It is calculated by dividing the number of people who died or of this disease, from this disease, by the number of cases of this disease in a given period of time. So, yun yung formula na ginagamit nila. Number of deaths divided by number of cases of disease in the given time period. Now, bakit nagkakaroon ng deaths? Again, if hindi pa nasusugpo ang disease. Now, in this case, what is dangerous about this is it's pandemic, plus this is new. It's not like the endemic diseases wherein nakadiscover na sila ng vaccines that if you go to that country, they can give you vaccines, right? So that at least you will not get it, or chances are rarely you will be affected. But this pandemic that is happening now, that's why it's affecting all of us sa Pilipinas, sa ibang bansa. It's simply because a vaccine has not yet been what we call discovered or created. Over the world and even in the Philippines, of course, has taken a lot of lives already. The CFR is quite high already, or the case fatality rate. However, thankfully still, hindi pa rin siya kasing laki nung ibang pandemic na nangyari for the last, few years. We'll talk about that in another video. But then again, what are the other vocabularies or terminologies that is also related to this? So, when we talk about case fatality rate, we also have what we call, paano ba siya kumakalat? So, we have what we call the community transmission, or what we call community spread. So when we talk about this, these are infections identified in a given geographic, are without a history of travel else aware, and no connection to a known case. So this was defined by WHO, or World Health Organization. Now, the transmission could be in different forms. Now, for COVID-19, we have what we call the droplet transmission or droplet spread. Now, how do they define this? So, when we talk about droplet transmission and spread, a mode of transmission for a contagious disease that involves relatively large, short range, less than 6 feet respiratory droplets produces by, number 1, sneezing, coughing, or talking. So this definition, we got this from CDC again. Now, another terminology that you might hear in the news is what we call viral shedding. Viral shedding is defined as the period of time the virus has replicated in the host and is being emitted. So again, dumadami siya, nag-spread siya. So that is what we call viral shedding from that person who's actually what we call spreading it. There is also, let me just take a look. I know I have kept it somewhere. So there is what we call a super spreader. So it means that this is a person infected by the disease, and I think the multiplication of the virus from that person is really very fast. So that is what we call super spreader. Wow. I hope we don't meet any super spreader. Now, because of this, dahil nga maaring meron pang what we call super spreader, how can we ensure that we flatten the curve? Yan. Naririnig niyo po ba yan? So another terminology that we have is flattening the curve. What does it mean? You often hear a lot of newscaster use this. So flattening the curve. This simply means that gusto nating masugpo. Okay? Gusto nating mapababa. So, curve usually, okay, let's take a look at the terminology. So, this simply means that we want to slow down the spread of the virus. Spread to reduce, flattening the curve also means to slow down the spread or to reduce the peak number of cases and related demands on hospitals and infrastructure as per CDC. So, let's take a look. So when we say flattening the curve, so usually they are using graphs. So it's simply we want to ensure yung mga spike na tumaas, we want to flatten it, pababain siya as much as possible. Now, at the same time, flattening the curve also, sabi nga ng CDC, is this because mataas yung number, kapag finlatten natin yung curve, it means also yung demand, very high demand sa hospitals and infrastructures or the building, hotels, where we do the isolation and the quarantine will be lessened. Oh, 2 more words. So we'll define that later. So again, syempre, if the cases are very high, so definitely, katulad ng nangyayari ngayon all over the world and in the Philippines, so a lot of hospitals sometimes hindi na nila ma-accommodate yung may mga sakit ng COVID simply because they don't have any space anymore. So thankfully, we'll take a look also at this on the other video. We have what we call the bayanihan and other like big spaces such as arenas are offering their places para maging make up what we call areas for some COVID patients as well. So that's quite great as well because as of now, because the curve is not yet flattened, so there's still quite a high demand when it comes to our hospitals and infrastructures too. So that's one word. Now there are 2 words that I have mentioned, and these are words also that are commonly misinterpreted and at the same time nami-misinterpret din ng ibang tao. So let us just take a look what are these words. So if we want to flatten the curve, there are actions that are being done and should be done not only by medical practitioners but at the same time the government. So let us take a look at this. Wow, these are 5 words that are commonly in the vocabulary of individuals like us nowadays simply because palagi nating naririnig ito sa news. Now, the only thing is like, in the Philippines, masyadong common ang word na PUM at PUI, while in the United States or in UK, ang mostly na ginagamit na word is isolation and quarantine. But then again, these are still related words. And what does it mean? So, we were discussing a while ago or sharing to you what we call flattening the curve. Now, in order for us to flatten the curve, we must have what we call actions by the government and at the same time the medical practitioner. So, when we talk about ensuring this pandemic, because it's a sudden increase of number when it comes to this contagious disease, and not only that, it's not only contagious but it is also deadly, right? So we have to ensure na ma-stop to at the very fast way that we can. So we have what we call isolation, quarantine, social distancing, and just like what I've said, PUI, PUM. So let's define each one. Now, the first one is isolation. If someone is already affected by the disease, so just like what you've said, we have to separate sick people with a contagious disease from those who are not yet sick. So they have to be isolated. So that is the word. If a person is already affected by COVID-19, the person is isolated. Now, what does quarantine mean? Ito yung common na pagkakamali ng maraming individuals na ngayon lang gumamit o maaring nakarinig ng word na to. Ako rin naman po, first time ko na naririnig ko siya, pero you don't really give much attention to it because hindi naman siya palagi. I know that the nurses and the doctors in the companies I work and I worked for, they commonly use this for someone who's sick. But then again, ngayon, talagang ginagamit natin siya every day. So let us just take a look. So when we talk about quarantine, ano naman ibig sabihin nito? So, when we say quarantine, so this is separating and restricting the movement of people exposed or potentially exposed to a contagious disease. So this definition is from CDC of USA. One specialist or a doctor for infectious disease had mentioned quarantine doesn't have to be very scary at all. Actually, there is an effective way, or this is an effective way to protect the public. So, governments also use quarantine to ensure that at least the spread of the virus or the disease will be contained and controlled as much as possible to stop. So, masakit man sa atin ngayon, marami sa ating naka-quarantine. You and I are quarantined right now, not because we're sick. I think this is the common mistake of many people. So again, the definition of quarantine is separating and restricting the movement of people exposed or potentially exposed to such contagious disease, but not necessarily may sakit ka na. Okay? So hindi ka kailangan pangdirihan. Discuss natin yan sa ibang video ko wherein some people, porket na quarantine na, nadidiri o pinandidirian na, that's wrong. That's wrong, actually. You're being quarantined simply because tinitingnan nga kung meron ka ba, possible carrier ka ba, but not necessarily na meron ka, diba? So we'll talk about that because now we're doing quarantine. So this is what we call self-quarantine or home quarantine for 14 days. Is 14 days usually ang number na yon. And then, what else? For quarantine also, so this is being used in many ways. So OFWs, while they are in their company, like for example, seafarers are being quarantined for 14 days in the vessel, and then pag uwi nila, quarantine na naman. Imagine, right? So sigurado tayo, if nalampasan ng mga seafarers ang 14 days quarantine from the vessel, ibig sabihin healthy sila because hindi sila papaliparin o papaalisin ng barko if hindi sila healthy. That's a requirement. So discuss natin yan. And tapos another quarantine na naman sa homeland. Imagine, right? So there's no actually reason para para pandirihan ang mga seafarers. So, no to discrimination. We'll discuss that later. So, what else? So, when we talk about ways of the government to ensure we control the spread of the virus, so we have the isolation for those who are sick already with a disease. And then at the same time, for people who needs to be quarantined, all of us are quarantined because we don't want to either get and be exposed to it or become spreaders of the virus itself. So for the meantime, wala pang vaccine, we stay at home. Yes, so that is what we call the difference between isolation and quarantine. So these are two of the ways, aside from the other ways, the government is ensuring, or companies are ensuring na hindi na kumalat ng mabilis or to control the spread, the rapid spread of any virus or this COVID-19 dangerous diseases. With that, everyone, I know we still have several more days inside our room or inside our home. So stay safe, stay at home, save lives at the same time. With that, everyone, this is Jamey Iris saying, God bless you all, stay safe and stay at home.